So thank you for joining us. My name is Denise Grudin. I'm the Medicare Sales Executive with Western Health Advantage. And typically I'm joined by my co-workers, Rick and Michelle Lahuda. However, I am your solo speaker today. So Raymond's here though, he can help us. So we're gonna go into who is Western Health Advantage. Now, a lot of you have already been on our webinars, so this might be redundant, but hopefully you'll pick up some information that you might have missed and have an opportunity to ask some questions you might not have had till now. So basically, Western Health Advantage has been caring for our communities for well over 20 years. We're heavily involved in community events that give back to our community. You know, we believe in taking care of the people in our communities, including those of us who work in our communities. We have aligned ourselves with a very strong network of physicians and hospitals, and these are very well-known and highly regarded physicians and hospital networks. In fact, they're our partners and have been since the beginning, some of them. We're a local and nonprofit company. In fact, we believe that patients come far before profits. That's why Western Health Advantage puts 90% of every premium dollar back into patient care. So that goes back to you, basically. So by now, everybody should have received their card. What I want you to do is make sure you look at your ID card that came in the mail. On the front, you should see the medical group, the provider's name, and your ID number. Now, we have several providers that align with different networks. So make sure that it's the network that you had requested that your doctor's practicing out of. Like here in Sacramento, we have Dignity and we have Hill Physician, and we have doctors that work in both. So on the front of your card, you're going to have your information that you need to present to your physicians. On the back of the card are very important phone numbers. If you need to call member services or your provider needs to call with a question or verification, and for the pharmacy as well. So all of you also should have received your welcome brochure by now. And if you have, I certainly hope that you've had a chance to look through it. In there, you're going to find several phone numbers, helpful tips, a lot of information that helps you as a new Western Health member and shows you where you can get assistance on certain topics or questions that you might have. So getting started with Western Health, we have talked about this on every single webinar, and I certainly hope all of you have had a chance to at least look at the MyWA account login and start the process. So this is part of your pop quiz. If you could please just say aye or no or yes, if you've had a chance to set up your MyWA account, that would be terrific. If you need help, go ahead and put in the chat box that you need assistance, and I'll personally call you and try to walk you through it, okay? It's real important because the MyWA login is your portal to bring you to the links for all the other benefits that you have within your plan. So if you haven't already, what you want to do is establish an appointment with your primary care physician. Whether you have kept the same doctor or you have a brand new doctor because you're just new to Medicare or new to Western Health, either way, you want to establish this appointment with your primary care doctor to coordinate your medical care. If you have, say, a standing referral to a particular specialist or a prescription that you have set up on mail order, you're going to need to reestablish that. Even if you're an existing patient of that doctor, you're a new Western Health member. So you have a new ID and a new type of plan with Western Health. So you'll need to reestablish those referrals and prescriptions as well. So you have different options for seeing your doctor. You can see your doctor in person using traditional in-person office visits, but many of our medical groups offer telehealth. You should check with your medical group or ask your doctor if they provide telehealth It's an easy and convenient way to see your doctor or discuss, a concern you might have without actually having to go to the doctor's office. As Michelle likes to say, it saves you from downtown parking. So that is an option if you're comfortable with that, or you can still, of course, see your doctor via an in-person visit. Now, the telehealth services vary, so we really urge you to check and double check with your primary care or the medical group. So for urgent care, now, for situations that might be a little more than a cold or flu, say you sprained your ankle, you have a bee sting, or something that's a little more urgent than, say, a doctor, but you might not understand if you have to actually go into the office or not. There's also teledoc available for 24/7 urgent care. This is in lieu of actually walking into an urgent care center. So it's relatively the same as telehealth, but it's for the urgent care issues. Again, cuts, bruises, sprains, things like that. And they can advise if you need to come in, go to the emergency room. But first, you should always try calling your PCP. They might not be available, though, in the middle of the, well, they're always available, but you might not want to call them in the middle of the night. So the teledoc is a great alternative option. You also have choices for your specialty care. Even if you're a member of, say, Meritage Network or North Bay Medical Group, let's just say you have a need to see an orthopedic specialist, but the one you want to see is at Hill Physician in Sacramento. Well, all of these medical groups are in our network, so most of the doctors within those medical groups are participating in our Advantage referral program. This allows you the opportunity to ask your doctor if you can have a referral to a specialist that you want to see. The request needs to come from the member. So if you need orthopedic or some other type of specialty care, of course they will refer you to somebody in their own medical group. But if you have somebody you prefer to see, you can always ask your PCP for this referral. And as long as the doctor is participating in the Advantage referral, it's usually not an issue. There's some limitations, so just start with your PCP. Now we have transition of care. Many of you are receiving care from non-participating clinical providers. Well, you may be able to continue seeing that doctor if you meet the transition of care requirement. It's important to understand the different requirements. So we recommend that you either call our member service team or go ahead and visit the mywad.org MyCare COC. That will tell you the terms and conditions for continuing your treatment and, basically what the rules are around that. But it's pretty simple, and it might just be easier to call member services, and they can help you with that. So prescription drug coverage. You can purchase your prescription drugs at the retail pharmacies, and in case you hadn't had an opportunity to look on our facilities finder, you pull up pharmacies from basically find a provider or facility section on the Western Health homepage or the Medicare Western Health homepage, and you search facilities. You can at the drop down choose pharmacy, and it'll bring up all the pharmacies in your area. So it's not just the major chains like Rite Aid, Walgreens, CVS. We've got several local, hometown pharmacies that are in our network as well. We've got a couple here in Placerville that are actually in that network. So I urge you to go ahead and look at that, but you're not going to have any trouble finding a pharmacy that's right down the street from you. You also can take advantage of the mail order program through Costco or PPS RX. With the mail order, you do have a slight cost savings on your prescriptions if you're taking regular medications that you already have on mail order or want to consider using the mail order service. Again, if you have an existing prescription for mail order and you're new to Western Health Advantage, you'll want to get those transferred over. So on the next page here, we've got our phone numbers for the Postal Prescription Services and Costco mail order. If you call either one of those numbers, they will be very helpful in helping you get your prescriptions transferred under the new. Say you're already using Costco. Well, you're under Western Health now, so you'll want to have your prescriptions transferred to that plan as well. You don't even need to be a Costco member, I found out, to get your prescriptions there, which is nice. Got our specialty care. This is for your, specialty medications that may need to be, say, administered only by your physician or by a caregiver at home. These are taken care of through Grudin Health, and the phone number's here. It's also in your welcome brochure under the prescription section, I believe, page 6. So behavioral health. Now, this is a benefit that's included in your plan. And we had a terrific webinar on our behavioral health series. So just to reiterate, there is no PCP referral required. You can go on to find a provider, and on the right-hand side, there's going to be a section for behavioral health. You can search for a provider in your area to seek out care. You know, all of us have gone through quite a year, some of us even longer than that, and sometimes you just need somebody to talk to, just kind of tell them how you're feeling about the situation or maybe something different. So you have this benefit, and we really encourage you to use it if you need it. It's there for you. There's nothing too small or too large that you can't reach out and contact our behavioral health professionals for. And again, there's no PCP required, referral required. They also have video or phone if you don't feel like going in person. So it's convenient for you as well. Okay, well, the MyCare plans, MyCare and MyCare Plus, are loaded with a lot of extra benefits. All of you have an over-the-counter benefit allowance, which allows you to purchase things anything you'd buy at a pharmacy or drugstore that you don't need a prescription for. So that's bandages, toothpaste, Q-tips, masks, all kinds of things. And you want to use that credit because it does not roll over. On the MyCare plan, it's a $50 credit. On the MyCare Plus plan, it's a $100 credit, and that's per quarter. So there's a lot, actually, you can buy for that allowance. So we encourage you to do so. You should have received your brochure with the different items listed in the catalog from First Line Essentials. They sent that out the first of the year. But you can also get to the link to sign up and shop online or receive the phone numbers that you can place your orders with. That's through the MyWA portal. So make sure you sign up if you haven't already. Again, the behavioral health services is available to you. That's actually a benefit rolled in. That's not an extra. It is your benefit. Wellness benefits, which include your Silver and Fit program, alternative care such as the acupuncture and chiropractic routine services, and global emergency assistance. So you have worldwide travel on your plans as well as additional benefits, which we'll go into in just a moment. Now, you have your annual eye exam. You receive your eye exam through your provider and medical group. Once you get a prescription for glasses, if that's the case, or contact lens, you have an eyewear allowance over and above what the benefits provide. That eyewear allowance gives you $100 or $200 credit for your glasses, your frames, or your contact lens. That's through our MES network, and that is just for the hardware. So First Line Essentials, as I mentioned, is the over-the-counter provider, and with those credits, again, you can purchase things like toothpaste, vitamins, pain relief, and there's so much more. The orders are placed strictly over the phone or online. It's very simple, and it's delivered right to your home within 24 to 48 hours at no cost to you for shipping. So this is a very, very convenient way to shop for those items that you need. But my word of advice, make sure you order everything you need at once. Place one order, use your credits. If you go a little bit over, they do have an option. You can pay for additional items, but again, your credit takes you a long way. So our Silver and Fit program, this is a wonderful program for our Medicare members. It's very flexible. It's actually tailored to the unique needs of each member. So you talk to a counselor or talk to somebody at the gym if you visit the gym, and they'll put together a program that's specific to your needs and help you reach some of the goals you need to reach. There's, in addition to in-person visits from our fitness centers, there's digital workouts, videos, coaching, personal coach, and they have a ton of tracking tools and devices. We can get more into that if you'd like, but I'll go ahead and send some information to everybody after this call. It's amazing how much you get in this program. I learn something new every time I listen to our expert on the Silver and Fit. Now, our health and wellness program, this is available to all Western Health members, including our Medicare members. And here, this is basically your hub to all things good. Now, in the wellness program section on our website, you'll be able to take a survey, set some goals for yourself, kind of see, where you're at and what you can do to improve things for yourself. Once you learn that by taking this survey, you'll get recommendations that are tailored to your needs based on your answers. So I encourage you to take the wellness assessment just to kind of see what you might need to focus on or what you might want to focus on. So it also includes things like the disease management programs. These are included in your health benefits plan at no additional cost. You can actually connect one-on-one with a personal nurse who can work with you right over the phone to help you live your healthiest life. Just go ahead and log in, see the programs that are available to you in your plan. And in addition to that, there's a lot of resources. There's like Nurse 24. You can talk to a nurse any time of the day. They can help you. These are registered nurses. They can help you decide if you have an issue going on. You need to either, nurse it at home, go into an emergency room, or call your provider. It also offers gym discounts. Even though you have the Silver and Fit rolled right into your program, there's some gyms that might not be in the Silver and Fit program that you really want to go to. Well, as a Western Health member through the wellness program, we have a plethora of gyms that offer discounts to any of our members. So you might want to just check that out as well. You just put in your zip code or the name of the gym, and it'll tell you if there'll be a drop down for the insurance carrier that you have. And basically it gives you, a discount, whereas the Silver and Fit, there's no charge whatsoever for you. It also has wellness classes, stop smoking cessation programs, community fit, which are awesome. From what I understand, because COVID hit shortly after I joined WA, I wasn't able to go to any of the community fit programs, but they have some terrific activities right out in the community where you can join in. They've got healthy recipes. Maybe you could pick up some tips on certain foods that you love to eat or things that will help you that actually taste good. And of course, there's the urgent care available through there as well. So the alternative medicine is offered through Landmark. This is for acupuncture and chiropractic benefits. Again, there's no PCP referral required for our acupuncture or the chiropractic benefits. You simply go on to the acupuncture and chiropractic provider search on the website, and you can look for doctors in your area if you don't already have one. This is a great way to help, ease some of that tension that might be causing your neck and shoulder pain, or a lot of people use acupuncture for healing for certain conditions. Depending on the plan you have a combined visits of 10 or 20 per year. And again, I really want to encourage you to use the benefits in your plan. You'll be happy you did. Okay, travel assistance. So over and above our worldwide travel, we have exclusive to Western Health Advantage members a program called Assist America. Basically, when you're about 100 miles or more away from home, let's say you lost your prescriptions, you forgot your prescriptions, they can help you get those filled. If you are out of the country and for some reason need to find the closest consulate or embassy, they can help you find that. They've got a terrific app right on your phone. You can get directions straight to the consulate. They help you with, finding a local hotel or attractions, even if you lose your luggage. Let's say you're traveling with the grandkids and something urgent comes up, they'll assist you in childcare. So there's just a ton of different things that this program can help you with. Again, you can get the information right on our website, and I encourage you to take a look at that because, things are starting to slowly open up. We might not be traveling internationally right now, but you might be driving down to Southern California or something to see the grandkids or just take a trip to Pismo Beach. That's 100 miles away. Heck, just going down to the Bay Area from Sacramento is 100 miles. So there's a lot of opportunity for using this program should the need arise. Now, vision care, we talked about this. Again, you're going to get your eye exam from your medical provider within the medical group, and you get your hardware through the MES Vision program. Now, you can fill your prescription right at your doctor's office. That's fine. But you might also want to look into stretching those dollars a little bit and getting maybe a nicer pair at a Target or Stanton Eye Care, or I think there's Costco offers eyewear at a discounted rate. So, you have a lot of options with it, anywhere that accepts MES Vision. So with that, I'm going to open it up to all kinds of questions, and I hope this helped. But again, we're going to harp on the MyWA account. If you need help getting that set up, I will call you myself, and I will walk you through it. You just have to let me know. So Raymond, do we have any questions?
Yes, Denise, we do have one question that I can see. And the question is, can you explain the difference between standard versus preferred on the prescriptions?
Standard versus preferred. Standard generic. Okay, so a preferred generic is one that, say that there's two different generics, two different, I guess, brands of generic. Well, we're gonna put, so the preferred one is going to obviously be the less expensive generic. And the only difference between them, there might be different properties. It's the same medication, but made by a different manufacturer. And it could be slight differences in the properties or availability, whatever the case, but it puts it in standard or preferred. So our preferred generics are zero copay, and the non-preferred or preferred are a $5 copay. We really appreciate you choosing Western Health, and we want to do all we can do for you. So just let us know. All right, everybody. You have a great day, and thank you so much for joining us. We appreciate it.